Welcome back to Real Health. We're at the end of the show, and if you missed the earlier segments on today's topic, well, it's centered on exploring the work that the chiropractor, biokineticist, and physiotherapists do to help relieve pain and improve mobility. We're going to squiz through some more questions here. Lauren says, I've read that overweight school bags are causing children back pain. What can I do to ensure my kids don't suffer from back, neck, and shoulder pain? Shay.
Sure, it's such a tough one. You know, these kids have obviously the responsibility of having so many books and stuff at school. One, don't just carry it on one side. That's the best advice that I can give.
Yeah.
So have it on both. You know, I think if schools can have systems where they've got lockers though, where in between lessons they can pack most of the books that they don't need just away, that's the best advice I could give. I think there is the pulling one, and then just swap your arms.
Yeah.
You know, so that you're not just sort of
That's good
pulling from
advice
one
for the
side
average
as well.
person as well. Stop carrying bags only on
Just
one,
on the one side.
Yeah, exactly.
Definitely, it's very important.
Mary, what is vertebral subluxations? I hear this term quite often, and it sounds dangerous.
So that terminology goes way back to when chiropractic was originated back in 1895. But they were looking for some way to describe the lesion that a chiropractor was treating. It wasn't a dislocation, where, as I said earlier, the joint had jumped right out of place and was put back in place. And it was less actually than a luxation, which is quite a profound movement of a joint.
Okay.
But it's not quite a dislocation. So they found this term subluxation, which is quite confusing actually, and I'm not sure why. But essentially, what it means is that there's a lack of mobility. It doesn't mean that in the medical term, the subluxation is where the joint has kind of moved somewhat and there's been ligamentous tearing and soft tissue damage. Within the chiropractic context, that subluxation doesn't necessarily mean that there's been dramatic disruption of the soft tissue. But there's caused some strain at the area of the joint, and that's what's then setting off the pain receptors and causing back pain, which then causes secondary muscular contraction and spasm as a protective mechanism, and the inflammatory cascade and all the stuff that goes with it.
Mandy, like most people, I spend my day 8 to 5 at my desk and often have terrible lower back pain and spinal pain. I suspect it could be posture related. What are some of the tips that you can give me?
Stretching. Lots and lots of stretching. Everyone gets just super tight hip flexors, especially from sitting for so long.
Yeah.
And I mean, we've said it before, sitting is the new smoking. It's so bad for you. There are phenomenal ways to avoid that now. Standing desks are also fantastic now. So you can stand for 30 minutes, sit for 30 minutes, walk around a little bit, but stretch, definitely. Research shows now that the 30 or 60 minutes of exercise a day that we do is not enough to counter the amount of time we sit.
Wow.
Absolutely.
Yeah.
So it's definitely a problem.
Okay, so move around. Liesel, can osteoarthritis cause nerve problems, and who can help me with the solution?
Well, osteoarthritis will cause inflammation, so that the cartilage becomes degenerated, but you normally also get inflammation of the actual capsule of the joint, and then if there's nerves and soft tissue around there, that can also become inflamed, and then that is when nerves can be impinged or nerve receptors will be activated, and that's when it can start to cause pain.
Would you then have to seek nutritional advice to bring down that inflammation?
No, not necessarily, depending on the level of the inflammation. If the inflammation is so severe that it's causing you that amount of dysfunction that you can't work or function properly, then maybe you will need some other intervention to help reduce that. But very often just the right kind of exercise or the right type of mobilization or the right kind of stretching and relaxation, maybe some ice therapy, something like that. Definitely not heat therapy when something's hot and inflamed. That can make a huge difference to relieving that kind of problem.
And what most people don't realize is rheumatoid arthritis in an inflammatory state needs rest. It needs immobility of the joint. But osteoarthritis, those joints lack movement. The movement gets the synovial fluid moving, and that actually starts to
So rheumatoid arthritis needs rest, osteoarthritis needs movement and mobility.
In flare-ups,
okay. Chris, how do I go about choosing an appropriate exercise that's right for me? My joints are pretty weak, possibly due to having abused them with weightlifting.
So I would recommend to see a biokineticist. You know what the nice thing is? So we could do a whole approach again. head to toe. You see what the person's body posture looks like, see how mobile they are, see how stable they are. There's a few primary movements, a squat, a lunge, active straight leg raise, things like that that you should be able to do, and we can give you sort of a rating on each one and see where are your dysfunctions first before initiating an exercise program where you might end up injuring yourself because you have poor movement.
Yeah. You wanted to touch on the curves in the spine, not spinal curvatures.
So we have 4 primary curves. We're looking from the side for those curves. And so you have a neck curve, which is a forward curve. Between your shoulder blades, a backward curve. In your lower back, a forward curve, also called a lordosis. And across your lower, your buttocks, the sacral curve, which is more like a kyphotic curve. Those are very important for proper shock absorption. The spine, if it were absolutely straight, would crack somewhere in the middle from all the stress and strain that we apply to it. Now those curves develop from the crawling posture. So when the baby is on all fours and the head's up, the back dips. And those are the 2 primary curves, the neck and the lower back. Those are so important to allowing proper function and mobility and shock absorption and weight distribution and biomechanical function of the spine. But due to these things we've been talking about, like children with their head flexed down at the desk, carrying these heavy bags, slouching, playing TV games, the first curve to go is the cervical curve. So it flattens out. And once that happens, you change the distribution of the biomechanics of your spine completely.
Wow.
And so that's where the rehabilitation comes in a lot, is not just with the big muscle groups, but the intrinsic small muscles to help encourage those curves to come back.
So advice for text neck, because you mentioned it earlier on, but that's something that I've seen a lot of. You actually see people slouching nowadays.
Yeah, they slouch a lot.
Yeah.
And you basically, a lot of exercises would be good is to actually even stand up against a wall and practice pushing your head gently back against the wall, so that you're actually exercising those muscles, but you've got to keep your eyes level. So it's like a deep chin tuck. Would be also quite good. And then people just need to keep their mobility and exercise and keep moving. You know, that's the biggest thing, is that people just sit at a desk all day, or they're texting when they get home, or they're sitting in front of the TV, and then they're just not stretching, they're not mobilizing, they're not bringing their body back to its own sort of natural state. Exactly.
How do you know?
Support of the curve. So when you're sitting, to have something in your lumbar spine that's going to help to push you out that way, because automatically you will come forward. If you're slouching down, you're going to get into the C curve and take all the curves out that you should have. So sitting at a desk, you will often see people will sit on the end of the desk and they'll be working like this, causing a lot of strain on the muscles, because the back of a chair is called a backrest for a reason. It's there to rest your back.
So are you supposed to push back into your into
bum and everything back?
back? Okay. And when you're driving, is it the same thing?
Yes.
You must put your head onto your headrest.
Yes.
Is that correct posture?
I don't know about your headrest. It will depend on a number of variables on your curve of your dorsal spine.
And it depends on the car seat as well. I think car seats, but definitely a lot of my clients that have chronic lower back pain, I find that their car seats are quite sort of almost curved like this.
Yes.
And then what I advise is that they take a small little pillow or a roller or something, and then they actually have that in the back, in the small of their back. And that, like you're saying, automatically starts to trigger your body coming back into its natural posture.
Another piece of advice is to also lift the phone up here and read. I mean, I tried it for a while, it doesn't really work, but at least I'm cognizant of it.
If you can imagine your hard palate, the top of your mouth, that should always be horizontal to the floor.
Oh, wow.
So if your head was down, it would be angled like that. And if your head was up, it would be too far. So you want to keep it parallel, in other words, to the floor.
I like
so that's
that
just
as a
little.
What's good posture? How do people get themselves into a correct posture? I remember in varsity, it was like rolling your shoulders back and then your thumbs out and then you leave your arm. It feels very weird, but is that correct posture?
Well, from my perspective, the correct posture is having those 4 curves adequately formed. And so if you were standing up and you looked at someone from the side and you drew a line from their ear, it should bisect all the way down the middle of the body. You'll see a lot of people are what we call anteriorly placed, so their head will be forward. So now all the weight bearing is coming down here, and these muscles have to work quite hard to hold up the weight of your head, which is around about 6 kilograms or thereabouts. For you clever girls, probably 8 or 10. But So when that weight bearing is such that the weight is coming down here, rather than axially paced coming all the way down your spine, then the spine can work as a shock absorber.
Yeah.
And that's where tension headaches and all this upper back and mid-thoracic problem comes from, because a lot of it is anteriorly placed, because we read too much like this, the head's too far flexed forward, all that sort of posture.
So I make my patients take a 1 kilogram weight, which this isn't anywhere near, and I just make them hold it like this.
Okay.
And then by minute, they're sort of doing this because they can't hold it up anymore. That's what your neck is doing all day when it's held like that. Yeah.
So what tips would you give to our viewers out there? Just one simple tip.
Well, I think literally if you can just practice sitting up straight. And just being, you've got to avoid this. So stop texting so much.
Okay, stop texting. And you, Justine?
I think it's just awareness of whatever you're doing. Like you say, trying to, make sure, that you feel like you're standing as straight as you can. And have that awareness, whether you're sitting, whether you're standing, whether you're working, even when you, at that point, if you can get to the point that when you're exercising, you're also aware, because I've seen people running and they'll be fine walking, but as soon as they start exerting themselves, then their chin comes forward. Or, so it's trying to do it. For me, good posture creates optimal biomechanics. So you want to create that and keep it going throughout your day.
Yeah, well, it's been fascinating. I have a better understanding of what each of you do, and I hope our viewers do as well. So thank you so much for joining us on Real Health. And if you enjoyed today, please let us know. You can pop us an email to info@thehomechannel.co.za. I hope you did find it informative. And I know you have many questions, and we'll probably have to go into different topics as well. But if you want to get in touch with our guests on today's show, and they really are awesome in their respective fields, you can visit thehomechannel.co.za for more detail. Until next time, remember our mantra: you are healthy, vibrant, and lean. Love and take care of your being. Cheers, guys.
It might be the summer trees, but I'm feeling better now. I'm feeling better. I'm feeling better. I'm feeling better.